Your Excellencies, ladies and gentlemen, the fight against malaria was threatened by the coronavirus pandemic, especially here on the African continent. The pandemic disrupted our health systems, it slowed down economic activities, and increased vulnerability for large segments of our population. Indeed, at the onset of the COVID-19 pandemic, the World Health Organization had predicted a doubling of malaria deaths in the event of severe disruptions to the distribution of insecticide-treated nets and access to anti-malarial medicines. I am, however, delighted to say that the predicted doubling in malaria deaths was averted in our African countries. Malaria deaths have been contained through door-to-door distribution of insecticide-treated nets, indoor residual spraying, and through the administration of seasonal malaria chemoprevention for children. All of this has been done while strictly adhering to all COVID-19 protocols. But the fight, ladies and gentlemen, is yet to be won. Indeed, far from it. The World Health Organization, through their World Malaria Report, states that Africa continues to bear more than 90% of the global malaria burden, and that progress in reducing malaria infections and deaths has been slowed, especially in high-burden countries. We, however, are still off track in achieving the ambitious targets that we set for ourselves in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. The COVID-19 pandemic has demonstrated the centrality of a robust healthcare system which provides universal access to all populations. Additionally, as African nations, our social economic recovery will also depend on our ability to innovate and generate solutions to issues such as malaria, issues which have for long bedeviled us. Africa must increase her capacity for local manufacturing of malaria commodities in a similar manner that we are now producing personal protective equipment for our own use. The spread and the development of the COVID-19 vaccine and the sharing of real-time data to inform decision-making provide instructive lessons for us in our efforts to eliminate malaria by 2030. I am confident that through working together, we can do it. And so I therefore urge my fellow leaders to champion the following actions in your respective nations. The first of these is to increase coordination and engagement on the elimination of malaria through regional economic communities. The second is to expand access to quality health care through national malaria scorecards to inform and to empower individuals and communities to take individual action. The third is to establish national End Malaria councils and funds to convene senior leaders across all sectors to champion malaria and mobilize action, resources, and also to drive accountability. And fourthly, to recruit and mobilize a new generation of youth to combat malaria. I take this opportunity to congratulate the African Union member states for the demonstration of unwavering leadership towards the elimination of malaria by 2030. Let me also take this opportunity to thank the Global Fund for the financial support to the African Union member states, which enabled them to avert the predicted doubling of malaria cases on the African continent.
The African region still faces a lot of challenges we need to overcome if we are to achieve our goal of eliminating malaria by 2030. The first step in this noble journey is to address the significant malaria financing gap in African countries, and indeed, about 63% of activities in national malaria strategic plans in Africa are today currently unfunded. It is against this background that I underscore the urgent need to increase our contributions and advocate for additional partnerships. I call upon all implementer countries to remain at the forefront of championing and advocating for a successful seventh replenishment of the Global Fund.
Your Excellencies, ladies and gentlemen, zero malaria starts with me, with you, and with all of us together. I thank you.